How do gene therapy breakthroughs impact family genetic discussions? Imagine a future where inherited diseases are no longer just a risk but something that can be corrected before symptoms even appear. That's what recent gene therapy advances are bringing closer to reality. These breakthroughs are changing how families talk about their health histories and genetic risks. When gene therapy can treat or even prevent genetic conditions, families feel more hopeful and open about sharing their genetic test results. Gene therapy works by fixing or replacing faulty genes that cause inherited diseases. Newer techniques like improved CRISPR gene editing are more precise and safer, making treatments for conditions like Tay-Sachs disease, which is more common in Jewish communities, more realistic. These therapies can stop diseases from developing or lessen their severity, which means families might see fewer health issues in future generations. Because of these options, families are more willing to discuss genetic risks openly. Instead of just monitoring or managing symptoms, they now have potential treatments to consider. This can motivate earlier testing and proactive health steps. For families with a history of genetic conditions, especially in Jewish populations where certain mutations are more prevalent, these breakthroughs highlight the importance of genetic counseling. Counselors can now inform families about new treatment possibilities, helping them understand their risks and options better. When it comes to family planning, gene therapy can influence decisions. Parents who know they carry specific genetic risks might think about gene therapies as part of their reproductive choices. They could also consider options like pre-implantation genetic diagnosis, which helps select embryos without certain genetic mutations. This can change how families talk about future generations and inherited health issues. But these advances also bring questions about ethics, costs, and long-term effects. Families need guidance to understand what treatments are available, how effective they are, and what they might cost. Genetic counseling becomes even more important to help families navigate these complex topics with clarity and sensitivity. In the end, gene therapy breakthroughs are making family discussions about genetics more hopeful and informed. They encourage families to share information earlier, consider new treatment options, and make decisions that could improve health outcomes for generations to come.